Hi, I'm Wendy Northcross, CEO of the Cape Cod Chamber of Commerce, and today with me is Kathy Tian, and she works for the Chamber at the moment, and we are going to talk about some of the new regulations for the new healthcare reform.
I represented the people of Abington, Whitman, and East Bridgewater for 10 years in the legislature, and it was an incredible experience. I was a member of the Joint Committee on Public Health, and we were part of the drafting.
So this is complicated enough that we want to just kind of go through those steps. You first have to calculate all your total payroll hours, divided by 2,000.
Yes.
And see if you have 11 or more full-time employees. If you do, then you have to go to offer them a Section 125 plan, and then you have to make sure that you file those HERD forms.
Yes, very important.
And after that, you then do have to offer some type of insurance if you're not offering it now. But you don't have to pay for part of it unless you're already doing that for some of your employees.
Right.
Okay. And then finally, the fair share assessment is
$295 per employee.
Okay, if they're not paying any health care.
Right, if 25% of your employees are not taking insurance through you.
Then you'd have to pay that $295.
Right.
Okay.
Yeah.
So.
But it's a work in progress, and things will change as we go. And I think it's so good that we have the opportunity through this grant to report back to the state what are the main issues for Cape businesses, what kinds of suggestions we have to make it work better, and also for employees and individuals who we're hearing even the lowest cost of $200 or $150 a month is a lot for a person making only $35,000 a year.
This is a very sweeping reform, and it is making healthcare perhaps more accessible, but it's not really making it more affordable at the moment, and it is stretching some people.
Yes.
The one thing that we were able to affect through this new law is that if an employer has H-2B visa workers or J-1 visa workers, they're bringing guest workers into the country temporarily and they're in legally, they don't have to offer them a Section 125 plan.
Which is great.
But those H-2B workers and J-1 workers should have their traveler's insurance when they come into the country. So there's a lot of nuances here that we were helpful in getting instituted into the new law, but there's a lot more to come, and we do sit with the connector on a regular basis. It seems simple, but it's not, and there are a lot of questions, especially when you apply it to your own business. So you can contact the Cape Cod Chamber of Commerce. We have a toll-free number that people can call, and we'll connect you with Kathy. That's 888-33-Cape Cod. That's toll-free. Ask for Kathy Tian, but you also have a cell phone. We call it the bat phone, so it rings wherever you are, and why don't you give them that number?
That number is 508-776-9533, and happy to set up appointments, which are free. They're one-on-one, where people will keep your information confidential and answer all your questions, and we've had excellent results from those. Also, you can contact me online at Kathy@CapeCodChamber.org. You can go.
Kathy with a K.
Oh yeah, I always forget. I think that's the only way. Kathy with a K.
Okay, and then finally, we are planning another seminar later in the fall because we expect there'll be some new information out of the connector, and the date for that has been set.
Tentatively September 19th, we're working on that.
Okay.
So, but we'll let everybody know. We'll do some press releases and some e-newses, and
but why don't we give them a final? We'll give them the connector website address, because a lot of this information can also be found online at www.mahealthconnector.org. And go on there. If you have questions, give us a call. You can come into the chamber office and have a private meeting with a counselor, or we can set up a place that's more convenient for the employer.
And online, it will help you find doctors that are in your area, in the certain networks, and a lot of the details about the plans.